We have renovation and equipping of National Spinal Hospital, where we've also provided 50 million. Our National Spinal Hospital is next to State House, just along the Woodlands Road. So we have a spinal hospital there, which is the only spinal hospital for patients with spinal injuries in the whole Republic. We have National AIDS Control Council, where we provided them with 200 million. This is funds to cater for, there is money which came from the Global Fund to National Syndemic. And that money apparently was, I think, sent back to the headquarters because it was put in a wrong account. So we have to regularize that. Then we also have to operationalize. We've given 100 million to the Digital Health Authority. This is a new under the Digital Health Agency, is a new agency, and therefore we need to operationalize that authority. So the next one is a wish list, which I would not want to delve into. But of importance, Chair, is that we have equipment which is within the under the managed equipment service, which is within the counties. And I think there are 94 hospitals. Apparently, we've not had a very clear way between, because there's been a forth and on and off between the national government and the county governments. When governors have been told to take over these services, I think they've reneged on it. And apparently, that is one of the key areas where we need around 3.5 billion to be able to make sure that that service continues. In the last financial year, 2023-2024, there was a budget line for 5.6 billion that was removed. And once that was removed, I think that has negatively affected the operations within the counties. But we have the suppliers for both CT scans, which are in the counties. We have theater equipments. We have renal services, which are ongoing within those places. We have X-ray facilities, which are ongoing under the MES. So if there is anywhere you can be able to find some funds to support it, then it will really be able to support, especially the counties, to provide those services. Thank you, Chair.
Thank you very much, Chair. And you make our work very easy because you are meticulous in your reports in terms of codes and names and everything, which makes our work easy even when it comes to writing of the certificate. Let me go to Honorable John Jogona.
Thank you, Chair. I think mine is just a question. We heard the other day that the President giving a directive that there will be no more innovations. And I have seen in your budget, Chair, that you have really allocated some money for innovations. What is is it a policy? Is it a policy issue? Did you put into consideration whatever the President said? Because he said among the many budget that we have seen across, we will not agree in terms of making that there is any innovation. So what informed that decision that you still went ahead and allocate money for innovations?
Member for Quisero, and I see your facility imezama.
That's what I want the chair to confirm for me. It's not in the wish list. It's not in the ones that he has appropriated for. Where is it? I'll be glad to know. If not, you know me.
I think I think the fiscal analyst will look into it. Yeah, because I'm even surprised that it is not there.
The only point, though, Chair, will talk about it is that unfortunately the monies you have indicated for community for here CHPs, unfortunately, is not available for cuts. So we'll have the discussion between me and you. So that is to guide you at your free time to look at your budget and talk to Abel and Julie. There are monies that we need to safeguard. So, but we'll talk together.
That Chair Health has more information than the then the committee, is able to correct the typos and the misinformation in his report, which I think is a good thing. That means the chair, you are in charge. You know what you are doing in this committee. But I must say, Chair, I want to support 3 projects. I want to support Ikolomani, I want to support Endebes, I want to support Huisero, and I want to support Weshmia Moroto's project. Thank you, Chair.
20 million. And I can see there you've written it's for construction and equipping of health centers. So you are sure if you allocate 20 million, they will build the health center and equip. That is one. Number 2, I've seen nothing, 0 for Nyeri. And I remember, I remember there was a time the president himself, he had come to Nyeri, and you saw the other day our villagers demonstrating in Kiawala. That is in Ken West. In our Ken West, we don't have even a dispensary. Again, in Nalumolo, we have a hospital there. And the president had promised that he's going now to facilitate and make sure that we have a facility so that we can now start utilizing the facility. And I am not seeing anything. It is 0.
Mount Kenya the whole.
Mount Kenya the whole, 0.
About the shortfall for medical interns. We've seen medical interns demonstrating. So I think this is one area we need to prioritize if we can get some money from somewhere. Secondly, Honorable Chair, Health, there are a number of regions that benefited from donor funds, and very beautiful hospitals were built, and that includes Samkura in Teso South. A beautiful hospital, but it has not been equipped or operationalized. What plans do you have for such kind of infrastructure across the country? Is there any allocation? Are they included in the provision that I've had? I had worked out when I think you presented on that for innovating and equipping health centers.
I'd like you to give us information on Kakamega level 6, which was transferred to the national government. I have not seen it anywhere, and do you intend to take it up? If you are taking it up, when will it start receiving funds to complete it and equip?
Let me ask, if we start funding health centers from here, what will be the work of the county government? And we give county government a lot of money for health. What is the work of the counties if we start funding dispensaries and health centers from where we sit? Thank you.
Honorable Chair.
Thank you, Chair. Chair, I think I'll begin with the question by Honorable Nyakundi on funding of health centers and vis-a-vis the role of the county government. In our constitution, it provides that the national government shall do capacity building and also technical assistance to the counties. That is in Schedule 4. And what we've seen is that the national government, because there are no people for national government and there are no people for county government. So long as you agree with the governor that he has no objection to you to support them. And I think that goes in a long way to help healthcare within our country. As I look at a program like the community health promoters, it is a co-funded program between the national government and the county government. So I think we need to look at how best we can be able to, between the national government and the county government, to work together. On issue about Kakamega Level 6 facility, as we speak today, the Jaramogi Oginga Odinga National Referral Hospital, the memo has been prepared and forwarded to the cabinet for approval so that it can be upgraded to level 6 and it becomes a national referral hospital. This underwent a process from the governor of Kisumu, His Excellency Professor Anyang' Nyong'o, who made sure that he wrote to the national government and handed over the facility. And therefore, they've even gone further to enter into agreements to make sure that the law is followed to make that. So for Kakamega, I think this was just said, but the process has not begun so far as the committee is concerned. So I think it will be important if Governor Barasa can be able to write to the national government so that it goes through the normal process, and he can consult his neighbor, Professor Nyang' Nyong'o, on the process.
Aseka, please.
On the issue,
I'll do it to answer, I assume, the Office of Governor. Thank you.
on the issue about Pukura facility, which the Vice Chair talked about, that this is a facility that is been built well and equipped. My advice to you is that if you can do, you meet the in charge, so that the in charge can be able to write what are the equipments that are required for that facility. Then we can be able to take it up with the Ministry of Health so that it becomes one of the facilities that can be equipped whenever they have equipment. We have other things, other equipments that normally come from Chaika and other organizations that support the government. So Pukura can be equipped through that. On the issue about Nyeri, by Honorable Mukami, as we speak today, I think there is funding for the KMTC in the place where you had named, Kieni. And that money has just been hanging because I think there is an issue about land. And if you can address that issue about land, that project can be able to take off because the money is there, but I think the issue is about land. And the other projects, your neighbor there, on the member for Kiamba, can tell you that there are ongoing projects within your region that are under the Ministry of Health. On the issue about refurbishment, as put by the member for Kiamba, I know there was a presidential directive to that effect, but we are not refurbishing already existing buildings. We are the buildings that were already constructed, that we had started to construct. We can't stop the construction if we can be able to put some money to complete them. Even yours is among one of the facilities we are building in your constituency and other constituencies. So I think it will be prudent for us as honorable members to make sure that those projects are completed. That's my take. Thank you.
Thank you very much, members. Chairman, very lastly, Honorable Atandi.
Chair, thank you very much. Chair, let me also say that Dr. Pukoza is my doctor, so I'm happy to see him here. And as he makes his presentations, Chairman, I want to be very blunt. The biggest crisis in the health sector has all to do with doctors. And when I see that the national government is building village health centers and we are ignoring to fund doctors properly, especially the issues that are in health, then I think we are also joking. Chairman, we have to collect all these small monies in the villages, and then we add those monies and then we give them to the doctors. That is what we need to do. Otherwise, if we are going to, I'm also going to ask for a village health center. And how is it going to help us? These are functions that are devolved, Chairman, Mr. Chairman. And Chairman, we are talking about a new Kenya, not the old Kenya. If the president was in your village and he gave you those promises should be cancelled. Let us put resources with the doctors, because that is the crisis the country is having. Unless we are not being sensitive to the crisis the country is having. Doctors were even sleeping at the gate of.
Doctors are paid by the county governments.
Yeah, so let us be serious, Mr. Chairman. I want to plead with you because I know you are a well-meaning leader. Whether the president promised you, let us stop these things and fund health doctors. Thank you.
Daktari.
Thank you, Chair. Chair, there was an issue which was raised about interns. With interns, apparently, when the ministry appeared before us, they committed that they are posting all the interns under the SRC terms, awaiting the court ruling from which is in Eldoret in the High Court. So as per now, I think that is an issue that has been resolved, and there is money to pay them up to maybe the next supplementary if there will be any deficit. Thank you, Chair.
Thank you very much, Chair. We are always informed when you appear before us, because you're also very conversant with the issues around your MDAs. But I also want to thank your team because they keep doing a good job. Otherwise, thank you very much, and we wish you a great weekend.
Thank you, Chair. Thank you, members of the Budget and Appropriation Committee. Have a good day. Thank you.